So today we'll be discussing, as I promised, what are the treatment options for menstrual disorder, meaning what are the treatments available for menstrual disorder. However, if you missed our first video on the causes of menstrual disorder and the diagnostic test stroke investigations to rule out this menstrual disorder, I advise you locate it either in my Facebook handle or my YouTube handle. And if you have not subscribed to my YouTube handle, kindly do so. It will help you to know when we drop some very interesting health topic. Now back to our discussion. What are the diagnostic, what are the treatment options for this menstrual disorder? Number one, that depends actually on your medical personnel and your medical history. Very important. So your doctor will look into your history and then know the best treatment available for you. Number one on the options are prescribing birth control pills. This will help to regulate that messes and help to reduce the bleeding, and in some cases even stop the bleeding entirely. Second is lifestyle changes, reducing those alcohol intake, sugar intake, caffeine intake. Those will help to reduce those cramping pain and those bleeding. And also over-the-counter drugs like ibuprofen can also be used to reduce those cramping pain and reduce those bleeding. And also, if you are overweight, you need to work on your weight, because excessive weight can also lead to all this menstrual disorder. In cases of heavy bleeding, for instance, your doctor may prescribe the thymic acid. This will help to reduce the bleeding, and also prescribe iron supplements to help reduce those ions that was lost due to bleeding. Antibiotics can also be prescribed if the bleeding is due to infections, and some surgical procedures are very helpful also, such as those laparoscopy, to be able to check that womb as a diagnosis tool and also a treatment tool, and what we call the endometrial ablation, in which the endometriums are destroyed to stop that bleeding. But this particular procedure is best recommended for women that are no more of childbearing age or don't intend to have children. And finally on the list is the total removal of the uterus if every other procedure has failed and that bleeding is uncontrollable, called hysterectomy. I remain yours sincerely. Thank you.